One of the biggest decisions that teachers have to make in retirement is choosing a Medicare plan. Today's session will help you make an educated Medicare decision when you turn 65 that is in your best interest. Our speaker today is Lucretia Ryan. She is the founder of financialfreedomforwomen.org. Lucretia is a financial writer, educator, and philanthropist. She's also a pretty great person. She didn't write that. That's just me editorializing. After graduating from Cornell University and spending her career at IBM, Lucretia is now helping women achieve financial independence. She writes articles to simplify complex saving and investment decisions to help women make financial decisions that are in their best interest. Because Lucretia does not accept any fees, commissions, advertising, or donations, or sell any financial or Medicare products, she is able to expose the hidden fees and financial traps and help women avoid being taken in by financial predators. She has spoken on the topic of Medicare Advantage's dirty little secrets numerous times. She will not only share her personal experience, she will explain how the Medicare choice can affect your health care for the rest of your life. What you'll hear today, no insurance company will tell you. Welcome, Lucretia.
Well, thank you, Dan, and thank you for that. So as Dan said, put your questions in the chat. So Dan is going to be my Guillermo from Jimmy Kimmel.
Guillermo, I like him.
Yep, yep. Except you don't have to, dress in silly costumes and ask strangers strange questions on the street. So put your questions there. I'll be taking breaks, and we'll answer as many as we can. Oh. Okay, so just before we get started, I just wanted to share a resource with you, my website, financialfreedomforwomen.org. And this is, you could subscribe to it. I have articles on making the right retirement decisions, articles on Social Security, the S&P 500, to make things simple. This is a good series on Medicare, choosing the right Medicare plan, and all the things that people won't tell you about Medicare. And then a section on avoiding teacher retirement disasters, and then avoiding some of the financial mistakes, identity theft, those type of things. So let's go back. And then you could also subscribe anytime or unsubscribe. And so just before we get started, a lot of people ask me, why do I do this? I don't charge for my services. I don't sell any products. I don't get any money. I fund it totally with my own money and my own time. And the reason is because of the the really sweet letters and emails that I get from people, of how I've made a difference, in their lives. And, I do this just to help people. And then I also get really nice emails from other people who have helped their parents, who have helped, their friends make the right decisions, whether I do Social Security, I do Medicare, a lot of, financial articles as well. And, it just really warms my heart that I do this. And I'll, like this month, the next month, I'll probably do like 10 to 12 of these for different organizations. And I'll just say that if you want me to do a Social Security or a Medicare session for your school district, I'm happy to do it. I'm doing it for a bunch of them this month during professional development. I could do it for Zoom. So I'm very happy to do this. But what I want to get out of tonight, what I think I'm going to get out is that at least one person who listens to my session tonight is going to make the right Medicare decision. And maybe sometime in the future, maybe if they get sick, they'll be able to go to the best hospital, see the best doctors, get the best care, and really improve their outcome and have Medicare cover it because they now know how to make a Medicare decision that is in their best interest. And I did not know this. I did not know any of this. Nobody has an incentive to make it simple like I'm going to explain it to you tonight. So let me roll right into it. And so when you turn 65, you have two choices for Medicare. Your first one choice is you say, you've been paying into Medicare your whole life. Yep, I want original Medicare. And what original Medicare has two parts, and you'll hear this, so I'll explain it to you. Part A, and this covers your hospital services. Original Medicare Part B covers doctor visits and outpatient care, MRIs, um, uh, X-rays, those sort of things. So Part A, whenever you go to the hospital, you have a deductible of about $1,650. And every time you visit a doctor, it pays for 80%. So there is this gap of what it doesn't cover. And that is called a Medicare supplement. It's also called a Medicare Medigap plan. And original Medicare you get from the federal government, but the Medicare supplement plans are sold by for-profit companies. And this covers the cost that original Medicare doesn't. And then the third thing is then you have to buy a Part D, which is a drug plan. And this is a different company and it's purchased from a for-profit company. The big difference with original Medicare is all approvals are made by the federal government. If there's no prior authorization, so if your doctor says you need this MRI, Medicare just pays for it, and then the supplement pays the difference. So that's one choice: original Medicare, a Medigap, and a drug plan. The other choice is you say, nope, I don't want my healthcare decisions made from the federal government without prior approval. I want Medicare Advantage. I want a for-profit company to manage my healthcare. So behind the scenes, no one tells you this, the federal government is paying them like $1,000 or more, and they are paying the doctors less. They are limiting the doctors that you can see, and they're using prior authorization to limit the procedures, and that's how they make their profit. So those are your two choices: original Medicare and a Medigap and a drug, or Medicare Advantage, which when you have Medicare Advantage, you no longer have original Medicare. And I'm going to go be repeating a lot of things. Don't think that I don't know I'm repeating it. I do, but this stuff is very complex. And if you hear it, and um, it'll make sense. And then I'll talk about what I went through with my mother to kind of make it real for you. So, as I said, your first choice, original Medicare. As I said, Part A, hospital care with a 1676 deductible in 2025, and you don't pay a premium. Then you sign up, once you sign up for Medicare Part B, you have to pay $185 a month to the government. That's whether you sign up for original Medicare or Medicare Advantage. You start paying the federal government $185. And as I said, original Medicare is Part A, Part B is doctor's visits, and there is a deductible of $257 in 2025. And then you have to purchase a Medicare supplement from a private insurer. So you go to medicare.gov and you pick a Medigap plan, and that's how you purchase a Medicare supplement plan. And then you purchase a Part D prescription plan. But this is the big deal. You can see any doctor or any hospital in the US that accepts Medicare. 96% of doctors who are not pediatricians accept Medicare. All hospitals take original Medicare. They can't stay in business if they didn't take original Medicare. That's a very different story than Medicare Advantage. So now let's say let me talk about your other choice, Medicare Advantage. You tell the federal government, nope, I don't want original Medicare. I don't have Medicare anymore. I want a Medicare Advantage sold by a for-profit company. So this bundles together Medicare Part A and Part B, plus a prescription plan, which is Part D. For those of you following along, they call Medicare Advantage Part C, just to confuse you there. But it's Medicare Advantage replaces Part A, Part B, and Part D. And as I said, they restrict you to a network of doctors, a network of hospitals, and a geographic area, typically. And but the cost, and this is sort of the hook, is sometimes it's zero. And you see all these advertisements. I mean, if you have a TV set and you're watching live TV at this time of year, there's no way you could get through the news or any show without seeing these Medicare Advantage advertisements. They are, and if anyone is turning 65, they probably can't open their mailbox because they have so many things on Medicare Advantage. This is where the insurance companies make the money. They never want to tell you about the Medicare supplement that they have because that's not where they make the money. They make their money on Medicare Advantage. And I told you initially, when you sign up for Medicare, you turn 65, you have to pay $185 every month to the government, whether you choose original Medicare or Medicare Advantage. So let's compare the two. And I'm going to talk a lot more about prior authorization, but any of you who have healthcare now, you currently have prior authorization. You want to get an MRI, your doctor has to argue with the insurance company to get it approved. That's prior authorization. And then another difference between original Medicare and Medicare Advantage is at the beginning of the year, Medicare sets a rate for different procedures. Oh, okay, you want an MRI, we'll pay $200. You want a knee surgery or whatever, $15,000, whatever. They set a rate for all these different procedures. Medicare Advantage pays those doctors and hospitals less. And so at the beginning of the year, the like United Healthcare negotiates with the hospital on what they will pay them. And sometimes the hospital will say, I don't want to work with you anymore. And they used to take a United Healthcare Medicare Advantage, and now they no longer take it. It's because they pay them less, they don't pay their bills on time, and they have prior authorization. Another big thing, which I've said already, is original Medicare with the supplement is accepted by almost every doctor and certainly every hospital. So, like for example, for those of you in the New York area, Memorial Sloan Kettering, top cancer hospital. They don't take most Medicare Advantage plans because people are flying all over the country to get the best care. So you could live close to Memorial Sloan Kettering, you have a Medicare Advantage, they won't take you. And so that is a very big deal and a big difference that no insurance company or Medicare consultant will tell you. So as I said, you have two choices, original Medicare and a supplement plan and a drug plan, or a Medicare Advantage. So if you decide to go with original Medicare, then you do need a supplement plan, also called a Medigap. And what I want you to walk away with is these are standardized plans from A to N. And why is G the best? It's in the middle of the alphabet. I don't know, but G right now is the best plan you get. So it's much more important that you choose the right letter than you choose the right company. So United Healthcare G plan, Aetna G plan, Cigna G plan cover exactly the same thing. So, uh, and I'll show you the chart next so you can sort of see what the difference of the supplement plans. But the supplement plans are heavily regulated by the federal government. They all have to cover the exact same things. So it really doesn't matter which company you choose. It's more important that you choose the right letter. And I didn't realize this. It took me a while to figure this out. Guaranteed coverage. So if Medicare covers it, they cover an MRI. Maybe they don't cover, right, another procedure, maybe cosmetic procedures, they don't cover it. But if they say that they cover it, then they pay their 80% and the supplement plan must pay their share. The supplement plan cannot require prior authorization. They can't say, nope, I'm not going to pay. They have no say. They're a quiet partner. They just pay their difference. Um, that is really a big, big difference. So this is a very good chart. And for those of you on a podcast that can't see the chart, uh, um, this is a Medicare supplement benefit chart. So it shows you from A to N what an N plan covers, what a G plan covers. So, I'm a big proponent of G. And if you look at it, everything is checked. It covers the co-insurance, the co-payment, the skilled nursing, and it doesn't cover the Part B deductible of $257. That's the only thing that the Plan G doesn't cover. So I did this session down in Florida, and there was a woman there who had cancer, and her bill, she had original Medicare and a supplement plan G, her bill was $1 million. All she had to pay, she had a G plan, all she had to pay was $257 the whole year. So that is the G plan. The other one that, you might want to consider is the N plan, and the difference is that N has co-payments, so G does not, but N has co-payments, but it's a little cheaper. So, you know, if you're on a budget and that makes a big difference, then maybe you might go with N, but otherwise, I would always recommend a G supplement plan. And this is new news and it breaks my heart, but I wanted to share it with you. So, as I've been saying over and over again, there is no prior authorization with original Medicare. However, this year, RFK started a pilot program just in 6 states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. They're going to have 17 procedures that are going to require prior authorization. They're going to hire companies that will use AI and pay them the percentage that they deny and save money for original Medicare. So it's very limited. This should not change your opinion at all. Well, do I really want original Medicare? You want original Medicare. This is a very, very tiny blip, but it is a slippery slope. And the only thing that you could do is write your congressmen, write your senators, because 2026 in November, and vote. That is the only thing that you can do about this pilot program that to me is horrendous. But I just want to point out, does not change anything. There are thousands and thousands of procedures that require prior authorization. And this is only 17, and it's only a pilot program, and it's only 6 states. But I wanted to put it in there, so that you know that this is going on. Um, so why don't we take a break here? So I've talked about original Medicare versus Medicare Advantage. And I wish somebody would have explained this to me so simply, because when I called up Medicare.gov and for my mother, no one explained this simply. They would read me a script. I would ask another question. They'd read me the same script. I'd ask a third question. They'd read me the same script. And I'd say, how would a senior possibly understand what you're saying? So, and I'll go into, why the insurance companies don't want to make it this simple a little later. But so now I've laid out Medicare and original Medicare and Medicare Advantage. Dan, do we have any questions in the
We
chat?
do, we do, but I'm going to start off with a joke. I asked ChatGPT for a Medicare joke, and they were really bad. And this one is the best of the bad ones. Here goes. Signing up for Medicare is like assembling a Kia furniture. You think you can handle it yourself, then halfway through, you're calling for professional help. And I think you have illustrated this is the case, Lucretia. Okay, let's get to the questions. Are the original Medicare costs automatically deducted from monthly Social Security payments?
Okay, so when if you start taking Social Security early, 62, 63, 64, when you turn 65, the federal government will automatically sign you up for Medicare and start deducting $185 from your Social Security check. And they'll mail you a card. You need to then fill out a form that they send you and send it back to them if you're still working and you don't want original and you don't want Medicare yet. But when you're 65, if you don't have a job that provides health care or you get it from your spouse, you have to sign up. Otherwise, you will pay a penalty for the rest of your life.
Okay. Question two. How do you get vision and dental coverage with original Medicare?
Okay, so to me, that's kind of a scam. So what Medicare Advantage does is they offer you these free services to get you in when you're healthy, when you're 65. So they offer you, not great vision, not great dental, but they include it it could be for zero premiums. And they do that to get you in there because later on, when you get older and sicker, and then you want to switch to original Medicare with a Medicare supplement, the Medicare supplement does not have to take you. Only when you're 65 do they have to take you without pre-existing conditions. So they pull you in with these low cost services, gym memberships, dental, vision. So, if you want vision or dental or whatever, you could buy it on the open market. You could buy dental actually on Medicare.gov. Um, it's peanuts. It's peanuts compared to what they would pay for if you have cancer. So I think that sort of answers your question, and it's a very good question because that's really what they use to pull you in.
And just to clarify, so what you're saying, Lucretia, is that original Medicare does not offer standalone or combined vision and dental. The only vision and dental things that would be covered would be those that are just medically necessary. Is that right?
Yep, yep.
Okay, another question in regards to Social Security and the payment of Medicare. Is Medicare deducted from Social Security before Social Security is taxed?
I don't know.
I'm not sure if the question is hinting at like, will the portion that's deducted for Medicare from Social Security mean that that portion of Social Security is not taxed? If that's the question, the answer is all of your Social Security will be taxed, potentially taxable, up to, depending on your income. So whatever the amount of Social Security is, that's going to be potentially taxable based on your income. Any deductions from that, and Medicare will be deducted from your Social Security. Any deductions from that will happen, but it will not reduce income in any manner or fashion. Now, Medicare premiums and supplement premiums might be deductible as a medical deduction if you itemize and your itemized deductions exceed 7.5% of your adjusted gross income, but that doesn't really apply to many of us.
Yeah, and I
And
have another chart a little later on talking about a, the additional Medicare tax that you might have to pay with your income. So
Oh, IRMAA,
I have a
yes.
chart on that, the dreaded IRMAA tax.
I
IRMAA,
feel
not
bad
just
for
a
all the people
hurricane.
named Irma. That's really not fair. Um, so on that previous question, the person who posed it said that is the question. So Scott, I think you got it right in what you were answering. Okay, this is a comment and then there is a question. It sounds like the only people who sign up for Medicare Advantage have to be tricked into it. Are there any pros to Medicare Advantage
Yeah, well, um, it's cheaper. It's cheaper. And
up
what
front, right?
it's up front, your month, and I'm going to show you a sample teacher one. Um, they your premiums could be zero. Um, so they want to get you in when you're 65 because your premiums are zero. So there are people who simply cannot afford a supplement plan.
Mm,
But 54% of people sign up for Medicare Advantage. The only thing that is advertised is Medicare Advantage. If you go to any United Healthcare and you put in United Healthcare Medicare, they won't tell you about the supplement. They will only tell you about um, Medicare Advantage because that's where they make their money. So and I argue with people on like the IBM retiree sites who love Medicare Advantage. Well, typically these are healthy 65, 70 people, and it's working out great for them. The problem is when you get older and you get sicker, unless you're in these four states, New York, Massachusetts, Connecticut, and Maine, you will not, you may not be able to switch to a supplement because they don't have to take you or they could charge you triple. So younger people, sure, they're very happy with Medicare Advantage, but uh, people who get older and sicker, and then I broke my heart. A woman called me up. Her mother was 88 in Alabama, and she had Medicare Advantage, and they wouldn't let her stay in the hospital, and she had to go home, and they couldn't find any nurse to come in that would take the low fee that Medicare Advantage was paying. And she said, "What can you help me?" And I'm like, "No, no, I can't because your mother's very sick. She's 88. She has Medicare Advantage. She's in Alabama, and no other insurance company is going to sell her a Medicare supplement plan. So she can't." All these advertisements say you could switch to original Medicare anytime. Yes, but the supplement plans don't have to take you after you're 65. When you're 65, they have to take you and they can't ask about pre-existing conditions. All you tell them is, I'm 65, I'm a female, I'm non-smoking. Boom, this is your price. Afterwards, after you're 66, you go back to the website. Oh, I want a supplement. You can fill out pages of questions about pre-existing conditions, what medications you're taking on, blood medications, high blood pressure. They would deny you. So it's so critical that you make the right decision when you're 65.
okay, a few more questions. What are the costs of the G plan?
Okay, I have a chart on that.
So
So we'll hold that.
you will cover that.
Yeah.
Okay. And then same with the F plan. Do you go over the costs of that?
Okay, so the F plan is no longer available. It's a better plan because it doesn't have the deductible, but
Oh,
you can't get it now. If you're new to Medicare, you can't get it now. So the G plan, so the way that you find out what is the cost is you go onto Medicare.gov, you put in your age, you put in your zip code, you put in your female, non-smoking, and then you say, I want to look at the Medigap plans. And then you say, I just want to look at the G plans, and they'll list out all the G plans that you could buy from Aetna, from United Healthcare, from Cigna, and what their monthly price is. And that's so, but if I were to say what it is, I'd say it's around $200 a month. And then you need a drug plan, and you could even get a $0 drug plan, even though, but the price is probably going to go up this year.
Okay. Two more questions that I've written down, and some new ones have come in. I think one of these has been answered, but if you are still working at age 65, should you sign up for Medicare Part A if you have medical coverage through your employer?
Okay, very good question. And let me make that a little broader. So if you have if you have healthcare through an employer, you can keep that. And every year your employer sends you a letter saying you have credible coverage, and you want to save that letter because, as I said, if you apply at a later date, they will, and you didn't have credible coverage, they will give you a penalty for the rest of your life. So, but when you're 65, it doesn't cost you anything to sign up for Part A. So yes, you can sign up for Part A unless you have an HSA. Scott, did they change that rule about the HSA
I
or not?
don't believe so.
Okay, so as long as you don't have a high deductible and you're contributing to an HSA, yes, definitely sign up for Part A when you turn 65. I'll answer another question. People ask me, okay, well, I've retired, but now I'm getting health care through my spouse's employer. Should I sign up through my spouse's employer, or should I sign up for Medicare and a supplement? And I always say, well, look at the numbers. And pretty much everyone has come back to me that they're better off staying on their spouse's plan than paying for the 185 for original Medicare plus the supplement plus a drug D plan.
Okay. And I think you've covered this, but
Yeah.
I'll ask it again. If you are 70 and currently in a Medicare Advantage plan, can you switch to original Medicare with a Medigap?
Okay. So there are only four states, New York, Massachusetts, Maine, and Connecticut, that require the Medicare supplement plans to take you without pre-existing conditions. If you're not in one of those states, you can try, and you certainly should try. Um, so during the open enrollment period, you could apply. They're going to make you fill out a long form about pre-existing conditions, and you may or may not be able to get a Medigap. But my opinion and my choice is uh, I'm not going to take chances. So if when I'm 65 and I'm a Florida resident, which I am, I may not be able to change. I'm going to pick original Medicare with a G plan and a drug plan. The drug plan I can change every year, but because I may get breast cancer and when I'm 66, like one of my friends did, and then there's no way any supplement will ever take me. So why don't we move along?
Sigh.
Uh,
Um, there's more questions. Should we save them for the next
yeah, why don't
pause,
we save
or you
them?
want me to go through them?
I'll go. No, let's keep.
Keep
Oh,
going. Your choice.
yeah, I'm going to keep going. Um,
So we'll
show
come
off
back to the questions.
fun,
Okay.
fun pictures here. So let's talk about some of the dirty little secrets, which I've sort of let out. Um, so insurance companies make significantly more profit selling Medicare Advantage plans. This was the biggest scam they sold uh, to the federal government. Hey, we could save you money by we're going to manage, what you pay currently. We're going to manage it, and we're going to save you money. No, the federal government is paying these Medicare Advantage plans way more than they're paying for original Medicare. So, as I said, they pay these insurance companies, it's more than $1,000 a month. And as I said, they incent you with these low-cost extras, dental, vision, hearing aids, gym memberships. And then these insurance companies pay these Medicare consultants 3 times as much to sell Medicare Advantage plans than the supplement plans. So I was gonna save this later, but I'll tell you the story with my mother. So my father passed away. I took over her care, moved her up by me in Connecticut. Uh, I was clueless. I had no clue about Medicare. I didn't know what Medicare Advantage was. I didn't know there was a difference. Medicare.gov was useless. And so I had called up the insurance that she had been using. They sent a very nice man to my mother's house. He was lovely. He signed us up for Medicare. And I thought, oh, how nice. He comes to my house and he's pleasant and he did all the paperwork and it was so easy and we're done. And I had no idea that he signed us up, my mother up for Medicare Advantage. And he is now paid by the insurance companies 3 times as much. Never mentioned a Medicare gap, Medicare supplement plan. Never knew that I had a choice. It wasn't until I took my mother, then she got a little older and sicker, and we took her into assisted living. And uh, the doctors that would come in to see the residents, I said, "Oh, will you see my mother?" They're like, "Yeah, sure. What does she have?" I said, "Oh, she has Medicare." And they look at the card and they said, "Oh, she has Medicare Advantage." I'm like, "Oh, no, she has Medicare. What's the difference?" Because it's Medicare Advantage, it's not Medicare, and it pays us less, and we don't take it. So I would have to drive her, to the appointments, and but I had no clue that it was Medicare Advantage. I mean, it said Blue Cross, Blue Shield, PPO. Nowhere do they put Medicare Advantage. Uh, and nowhere did I know that this nice man that came to her house signed us up for Medicare Advantage. Never discussed. And now let's talk about prior authorization. This is such a big deal. And people say that, oh, we don't have great health care in the United States. We do. If you sign up for Original Medicare with a G plan, there's no prior authorization. You can see any doctor, any hospital, and you don't need the insurance company's okay to get that paid. Prior authorization, the killing of the United Healthcare CEO, never in a million years could I possibly justify it in any way. But what people were surprised of was the outpouring of hate. And that was prior authorization. That was all of those procedures that you, with your current insurance, have to go through, that they deny you care. Just so that they make money. And right now, most of the time, they're doing prior authorization is they're using AI. Your doctor puts something in, you get denied within 3 minutes. That's AI. There's no even person looking at it. And and maybe you'll get an administrator in the company, insurance company looking at it, and then the doctor has to keep fighting and fighting to get approval. That's why these top hospitals, Memorial Sloan Kettering, Mayo, Moffitt, they're not taking um, Medicare Advantage because prior authorization slows them down. Every time they want to do another procedure, for their clients, they have to go through this laborious prior authorization. If you have original Medicare, there is no prior authorization. Here's a picture of my mother. So I have to throw in a little pictures. Um, uh, she's sitting in my backyard there. So, as I said, there with original Medicare, the supplement plan, and I did not realize this until it was explained to me, has no authority to deny claims. It's a G plan. This is what the G plan pays. So that's why it doesn't matter if you have United Healthcare, Blue Cross, Aetna. It's a G plan. It's federally regulated. They just pay their little piece. Um, this is another big deal. Switching to original Medicare later may be difficult. So when you're 65, they have to take you regardless of any pre-existing conditions. You're 66, you're 67. After that, the Medigap, the Medicare supplement plans can ask you all of these things about pre-existing conditions and can either deny you, charge you triple, whatever they want. Only a few states, New York, Connecticut, Massachusetts, and Maine, require the Medicare supplement plans to accept you after the initial enrollment period without asking about pre-existing conditions. So by pure dumb luck, my mother was in Connecticut. So we were able to switch her to original Medicare, and we got her a Medigap plan only because she was in Connecticut. If she was in any other state, there's no way they would have taken an 80-year-old with COPD. No way. So we would have been stuck. So there's a lot of misleading information. You know, they say it's open enrollment. You could switch to any plan. You could switch from one Medicare Advantage to another Medicare Advantage. They're happy to take you. But going to a Medigap, they don't want you. They don't want you if you're sick because it's not in their best interest. Whereas the Medicare Advantage plans, they're happy to have you if you're sick because they're paid more by the federal government if you have more conditions. Um, and then this is another scam in my mind. So, you know, some Medicare Advantage plans, especially the teacher networks, they say you can go out of network. Well, maybe. So some Medicare Advantage plans say you could go in network or out of network. But it's only if the hospital or the doctor will take the payment from them, which is, it's not retail and they don't have a contract with them, so they don't have to take them, only if they will take this lower rate. And most, if they're a specialist, or a top hospital, no way they're going to do that. If they were going to do that, they would have a contract with this insurance company. So it's very hard to use this out of network. But if you do, the doctor can charge you whatever they want, and then you are required to pay the difference. So they could charge you their retail price, and United Healthcare or whatever, Medicare Advantage will pay the doctor, their low payment, but you're responsible for the difference. So even though some of these plans say, oh, we have an out-of-pocket max of 5,000, 8,000, whatever, that's not talking about when you go out of network. But also prior authorization is still required when you go out of network. And they advertise these zero premium Medicare Advantage plans, but they could be very expensive because there's a lot of out-of-pocket costs that you could pay. Also, if you move, you may have to switch Medicare Advantage plans. If you have an original Medicare and a Medicare supplement, you could use it anywhere in the United States. So people who move down to Florida and have a Medicare supplement that they signed up for in New York, they could keep that, no problem. So you have to assume that your Medicare supplement plan is good for your life, and it doesn't matter where you move. Okay, let's talk about IRMAA. So this is another by the federal government. So if your income 2 years ago is over a certain amount of money, not only do you pay the $185 premium, but you will pay an additional tax. So for example, if you're a single filer, and this is 2 years ago, and your income was 106,000 to 133,000, you would pay 259 instead of the 185. So that's and so this is an IRMAA chart, and I have an article where I go into how you could reduce IRMAA tax, sort of tax strategies, but I'm not going to go into it here because we could spend the whole time through this. But just know that, think about this, that if your income, it, after you're 65 and you're not paying for Medicare, if your income is high, you will not be paying 185. You could be paying up to 628 if you're in, depending on what your income is, your required minimum distribution. Uh, so I talked about, well, why don't we take another break here and take some questions?
Okay, we have a lot of them. I moved one to the top just because I have a feeling it's probably on everyone's mind. How many months in advance of your 65th birthday can you sign up for Medicare?
Okay, so it's 3 months before your month and then 3 months after. So that is uh, the window that you sign up for when you're 65.
Okay. There's a bunch about New York and switching and in those states. I'll say them again just to make sure in case this hasn't been covered, but I think it has. So it sounds like a teacher in New York who retires can potentially switch from Medicare Advantage to a Medicare supplement plan, but not after age 65. And
No.
what if a teacher moves out of New York?
Okay, so this is the scenario. Uh, if you are a teacher in New York, you could you could use your plan. You could use your teacher retirement plan. Uh, And then if you're like, oh, well, the doctors aren't uh, taking me, I can't find a doctor, I'm being denied, I'm getting sicker, I should have signed up for original Medicare. If you are a New York resident, yes, you could switch at any time to original Medicare and a Medicare supplement. However, I just want to also point out that when this happened to my friend, 66, Connecticut, signed up for Medicare Advantage. She got breast cancer. At that point, do you want to start switching your doctors, switching your hospital? Yes, you can, but that's not when you want to switch. So, if you don't want to pay the additional amount of money and you want to, I don't want to say gamble, but you're like, well, I think I got good genes. Let me see if I could ride this for 4 or 5 years. You can do that, but just realize when you get sick and you want to switch, that's not the time you want to be switching.
Um, and more questions around that. In those four states, especially New York, is the opportunity to switch from Medicare Advantage to original Medicare. It's guaranteed, correct?
It's guaranteed and it's any time of the year, not just during
Oh,
open
that's big.
enrollment. I
That's
Wow.
didn't know
big.
that. I didn't know
And,
that with my mother, but that's true.
and I asked this question myself in the chat, and it was answered. Can you move to New York from a different state and then switch? And then someone said it takes 12 months to establish residency. So as a California resident, if I have a Medicare Advantage, but I'm on this call and I've been thinking about moving to New York and I want to switch. Can I move to New York and then switch after 12 months?
I think you could switch before. I don't know if you know this, Scott, but so I deal with this Medicare consultant, Gene Rainey, who is fantastic. And he is going to help uh, actually this woman from Alabama move to North Carolina and, you know, and uh, uh, and help her switch. So I think if you move to New York, I think you can switch, and I don't think it takes uh, 12 months, but I'm not positive about that.
Yeah, double check before you make that big move. Do brokers offer differing prices? I see ads for various insurance brokers specializing in Medicare plans, but don't know if it's all the same regardless of broker. And I guess this is talking about Medicare Advantage.
Yeah, no, the broker is just he's signing you up for United Healthcare's plan. And you're not behind the scenes, United Healthcare pays him a commission. So there's multiple United Healthcare plans. He could sell any of them, but he's selling United Healthcare plan. He's not marking up and reselling it. So the price will be the same regardless of who you buy it from.
Okay, good to know. So is the price the only difference between the different G plan providers?
Yes. And customer service.
Mm, that's big. My mother, 74, currently has Plan F for supplemental. Since the plan is no longer available, will she have to switch or is she grandfathered in, or should I say grandmothered in?
She is grandmothered in. She is golden. So if you have an F plan, don't let her be conned into switching. That breaks my heart. What United Healthcare did is they have nurses go as employees in these nursing homes, and they get these old people to sign up for Medicare Advantage when they have these fantastic original F plans. So guard that like the gold that it is.
Shame is all I can say when I hear that story. That is shameful behavior. Um, okay, two more questions here. Signing up for Medicare Part A while still working at age 65 has a $1,650 deductible. Employer healthcare does not have this deductible. Does it still make sense to sign up for Part A while still working?
There's no downside if you don't contribute to an HSA. There's no downside.
Yeah, because you're going to be still using your employer's health insurance. Yeah, you're not going to be using the Part A for hospital. I mean, and I guess unless there's secondary potential, right?
Right.
If I choose original Medicare plus a supplement plan and end up in poor health years later, do they increase my monthly premium to make me compensate for costing them more dollars? And I
No.
think they meant Medicare Advantage, Medicare Plus, they said.
No, original Medicare.
Oh, is it? Oh, yeah, I'm sorry, it does say
Yeah.
that.
So the supplement plan will go up every year, and it's not based on you. It's based on a different algorithm, and different states have the way that they price it. So it's not based on your use of it. It's maybe, now you're 80 instead of you were 65. So they charge 80-year-olds more than 65-year-olds. And different states do it differently, but it's not, oh, it's not like car insurance. You've had all these accidents, so they raise your rates. It's, oh, you're 80. This is what we charge 80-year-olds.
A couple more questions just came in. Confirming Part D has $2,000 out of pocket cap.
Um, I know they changed the rules about a year or so ago. I think that's it. Scott, off the top of your head, they changed the drug plan. They made it better, but it's more expensive.
Yeah, they did. I believe, yeah, they are capped at $2,000. Once you've paid, yes, $2,000 is the cap.
I think I know the answer to this question. Will Plan F ever be offered again? I'm guessing
No,
no.
no. And who knows when they'll take away G. So F had no deductible. G has a $257 deductible. Then you have N that has the 257 deductible plus copays. So if you have F, whoo, God bless.
Mhm.
Stay with it. But now if you are signing up, G is the best. But it'll just keep being grandfathered in. So
Or grandmothered.
grandmother.
Um, I'm sorry, I didn't understand the response about no downside depending on HSA.
Okay, so uh, if you get insurance from your employer and it's a high deductible, so I get my insurance through IBM. I'm on a high deductible plan, meaning my deductible is like 1,600 or whatever, and then so I'm able to put money into a special account called a HSA because I have a high deductible. So if me getting my insurance through an employer, I have a high deductible plan and I'm contributing to an HSA, then no, I can't sign up for Part A when I'm 65.
Okay. And is there a maximum number of days for long-term care on a supplement plan?
Okay, so long-term care is not covered by Medicare. However, if you go from a hospital to rehab, Medicare covers you for a certain number of days. I don't know them off the top of my head. That is not long-term care. Long-term care is a whole different animal, not covered by uh, Medicare. So you should not assume that it is. But like my mother, she went in for pneumonia and then she couldn't go back to the assisted living. She had to go to a rehab facility. She was in the rehab facility for a number of days. At that point, she had a Medicare Advantage plan. So they said, you're out of here. We
Yeah.
argued for a while and they still threw her out.
Yep.
Medicare Advantage, she would stay there. There's a certain number of days. I don't know what it is.
It's 100 days. 20 are paid
Okay.
by Medicare, 80 are partially paid by Medicare, and the rest paid by supplement.
On the
Okay.
topic of your mom, Rosie writes, Ms. Ryan, your mama is beautiful.
Oh, thank you. She
Nice.
would love this. She
And
would
then
love this.
one more question. Where can I find that graphic comparing the different supplemental plans?
Okay. So when you get this uh, uh, chart, um, here it is. Also, I, I, you could also Google it, Chat GPT it, but here it is in that uh, in this package. Here's this chart, but it's
And we'll post that. I have that as a PDF, I believe. It's the same as the last time, Lucretia.
yes.
Okay.
Well, the
Uh,
charts aren't the same as last time, so I gave you new charts.
okay, because we made a PDF from before.
All
Okay,
right,
I'll need to get
let
that
me
so I
let me
can.
let me give you the case study. So we'll talk about Jane. So she's a Connecticut teacher, and she's moving to Florida. So she has four choices. She's
Don't
been
do it. Don't do it, Jane. Sorry, kidding.
well, the weather is nice. The gators are a little much, but if you don't have a 12-pound dog, you're okay. So she's been told her whole career, you know, I have subsidized Medicare for my district. So that's choice A. Unbeknownst to her, it's a Medicare Advantage plan. They'll never tell her it is. She could also say, forget it. I'm going to walk away from this. I'm going to buy my own plan, a G plan as a Connecticut resident, or I could buy an N plan as a Connecticut resident. Or since I'm moving to Florida, I could move to Florida uh, before I'm 65, and when I'm 65, get a G plan in Florida. So let me show you how the numbers pan out. Because you said, why would someone take a Medicare Advantage? So her retiree plan, she pays $94 a month. If she were to choose original Medicare plus a G plan in Connecticut, it's 246. Connecticut is way more expensive than Florida because you can change at any time. So, um, unlike in Florida. So if she would get that same plan in Florida, it would be 182. And then if she decided, well, I'm going to choose an N plan, it would be 176. So that might be a choice for her. So these are her four choices. Her retiree plan has no deductible. The G plan has 257 and the N plan has 257. She does have copays with her Medicare Advantage. She wouldn't have any copays with a G plan. She would have copays with an N plan. But big, 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 her Medicare Advantage plan has prior authorization. As I've been saying 100 times, this time, there's no prior authorization with original Medicare and the G or the N plan. So, and she will not be able to switch after she's 65 if she's in Florida. She could if she was in Connecticut, but with her Advantage plan, she's limited what doctors and what hospitals she can see. With original Medicare, she can't. So it's a trade-off. It is in Connecticut. If I use this in Florida, uh, and some retiree plans, the delta might not be as big a difference. But to me, okay, another $200 a month is worth it for me to get the best health care possible, and see any doctor and not have prior authorization. Uh, and just to, so what am I going to choose when I'm 65? So as I've been saying, I'm going to choose a G plan so I can see the best doctors and see the best facilities when I'm sick. I'm willing to forgo the Medicare Advantage extras such as dental, vision, and gym. And I'm willing to pay a higher premium to ensure I have the best Medicare and drug coverage. And so I'm going to choose original Medicare and the supplement G, and every year I'm going to reevaluate my drug plan. So the way the drug plans work is, open enrollment, you go on Medicare.gov, you put in what your prescriptions are, and it ranks it uh, by how much you'll pay over a year based on your specific prescriptions. So every year I'm going to do that, and I'm going to say, oh, well, this year I'll choose this plan, maybe, and then, oh, well, now this plan has changed what's, the different tiers, and it's not covering this anymore. So now I'm going to choose this other drug plan. So you should and you can reevaluate your drug plan every year. So also in this, I gave you another links. So here's the one, How to Choose a Medicare Supplement Plan. That's an article that I wrote, and that has the chart in it. So here are links that you could use. And so what I hope that I accomplished today, and I think that I have, because from the questions that we got, I want you to make an educated decision. Uh, and I want you to really think that the decision that you make at 65 is the decision that you're going to have for the rest of your life. And the deck is stacked against you. 54% of people choose Medicare Advantage because they pay the consultants more. Uh, the AARP who has lets them United Healthcare use their name makes so much more money selling a Medicare Advantage plan than a supplement plan. I read their articles and they are not unbiased. Like they're like, well, these are the pros and these are the cons of Medicare Advantage, and these are the pros and these are the cons of a supplement plan. And I'm like, they are not even in the same ballpark. To me, the primary decision is, can I see the best doctor and not have prior authorization so that I could have the best outcome for my health? To me, I don't care what your spreadsheets say. I think that that is the critical decision, and nobody has an incentive uh, to spell this out so simply to you on what your actual decision is. So I hope that I've accomplished that today. And why don't we see if there's more questions, Dan?
Yes, there are three more questions here. Besides Florida, which states tend to have lower premiums?
All the states other than New York, Massachusetts, Maine, uh, and New York. I know they have higher ones they um, because because they have to take you regardless of pre-existing conditions. The other ones are much, much cheaper.
Okay. If I have a home in both, this sounds like you, Ryan, Lucretia Ryan. If I have a home in both Connecticut and Florida, is there any benefit to choosing one state over the other? I understand that Florida is less expensive, but Connecticut has more flexibility.
No, well, no. Well, you have to choose whichever you're a resident of. Uh, but if I were if I were a Connecticut resident moving to Florida before I was 65, I would get my policy in Florida because it's going to be cheaper. So as long as I have original Medicare and a G plan, I I would I choose it in Florida because I know Florida is cheaper. Whereas if I chose it in Connecticut, then it's going to be more expensive. However, if I was 70 years old, I would choose it in Connecticut, and then move to Florida because and bring it with me because if I'm 70 years old in Florida, now they're going to ask me pre-existing conditions and I may not get a supplement plan. So I'd probably purchase it before I moved if I was 70. But if I was under 65, I would choose it in Florida because it's going to be cheaper.
Okay, just a couple more questions, but I will say there's so many compliments coming in for you, Lucretia, into the chat. Just hope you have a chance to look at them. They're very heartwarming.
Can I just make one statement, but thank
Sure.
you. Um, so anyone in a school district, I'm happy to do this presentation and a Social Security presentation for PD, professional development, 1 hour, happy to do it, no charge, do it via Zoom, happy to do it. And you
How would
just
they get in touch
contact,
with you?
yeah,
Best way to get in
contact
touch with
me,
you.
financialfreedomforwomen.org. There's a contact me button. And that's how the best way to get in contact with me. If you have questions on Medicare, Social Security, whatever, contact me there and you can send me questions that way.
Fantastic. Okay, last two questions. If you have health coverage through employer post-retirement, do you only need Part A?
Well, no. Well, see, this is the way it works. So, so I work for IBM. They gave me a bucket of money and they said, you could spend this bucket of money with our retiree plan, um, but it's a Medicare Advantage plan. So everyone has to sign up for Medicare Part A and Part B. You have to start signing up and you have to pay the $185 a month. Then after that, it's like, do you want original Medicare or do you want a Medicare Advantage? So, um, so for retirees, me working for IBM, I'm going to walk away from that money because I'm a Florida resident. I can't be locked into Medicare Advantage. So I'm going to walk away from that money, just like a lot of teachers may make that choice. They may decide, even though it's subsidized, I've been told that I have this fantastic plan for the rest of my life. I have health care for the rest of my life. Now that they're educated, they may want to say, I'm going to walk away from that because my health care is my priority. And I realize what I'm being offered is a Medicare Advantage plan.
Okay, fantastic. And last question. If in New York you switch plans, say at 70, do you pay a higher premium than if you signed up at 65?
No, no, you
Okay.
pay, right. That's why these states are so fantastic, but that's why the prices are so higher because the insurance companies have less leeway.
Yeah. Okay, that concludes our questions and this wonderful session. I know, Lucretia, we are going to do this again. You're going to send me a link, I think, to this new presentation, and I will send it out to the attendees.
Well, I sent you the presentation and you're going to put it somewhere.
Okay. I've got to put it online, is what I need to do.
Right.
Okay. Well, thank you, Lucretia. Thank you for all the attendees. I have a feeling we should do this every year, Lucretia, so we will do
Yep.
this again. And I hope people take you up on your offer to have you present to their school or their group or whatever the case might be.
Okie doke. Thanks. Bye-bye.
Thank you.